So good morning and welcome to the Positive Podcast. My name is Zoe and today I'm with Brian Webster-Henderson, our Pro Vice Chancellor. So thank you very much for joining me. So should we fire in straight with the questions?
Yeah, that'd be great.
So our first question was, what are the main challenges that HE or higher education has faced in COVID-19 and lockdown, and how are we as the University of Cumbria addressing this?
God, that's a big question. I think there's been many issues. I think the first one has just been the utter disruption into the system. So very quick into lockdown, people suddenly thrown into working at home from staff perspective, students throwing into no more classes and learning online. And I think the suddenness of the disruption generates in people feelings of anxiety, panic, confusion. So I think that's probably been one of the hardest things that any university has faced, and particularly one like ours who has many campuses, and we're having to manage that across all of our campuses in the region and London as well. I think that's been a real challenge. I think the other things for me are around the just this sudden feeling of a lack of networking. So you come to work, you enjoy the interactions with staff and students, get your coffee and enjoy a bit of banter with the women in the coffee shop. And all of a sudden you're thrown into a situation where they just stop. And then after a pause, you could see that people in the university were beginning to think, well, how do I recreate some sort of networking? And we started to see online Zoom sessions or online Teams coffee sessions where people could just get together and chat. And it's not normal, so we've had to kind of adapt to do that. I think that's been quite a challenge. I think probably the last thing, Zoe, for me would be the social isolation, particularly for our students and particularly for those that have been in halls. So we've had about 150 students still in halls, and I just think, gosh, it would be so easy if they, you've got to keep remembering those students and not forget about them. We've got a duty of care to respond to them, make sure that they're cared for. What if they become positive with COVID? Who looks after them? Who gives them food, water? All the things that as a nurse you would tend to think about for your patient, I found myself thinking about for our students in halls.
It goes back to that basic care, doesn't it, that we always reiterate and talk about. It's really interesting as well that you've talked about the sort of technology as well that we've had to suddenly get very used to. And it'll be interesting to see whether that continues.
I hope it does in some respects, but I'll maybe expand on that a bit later if there's a time, because I think that's quite an important discussion actually.
Yeah, so we'll move on to the second question. So our first podcast is obviously with Dave from the mental health team, and we talked a lot about how lockdown has impacted the mental health of our students. So we recognise a lot of our students are key workers at the moment. So what advice or support would you give to those that are finding this time particularly difficult?
Probably a range of things, if I'm honest. So many of our students, as you know, have opted into practice, but some have opted not to go in, either for personal reasons because they're shielding, or they've got a member of their family that they're trying to protect, or for their own very personal reasons. And so I think this time we've got to realise that all of our students are playing their part, whether they've gone in or not. It's important that we don't see a distinction between those groups of students, and totally respect those that chose not to go in for whatever reason. And I think as professionals we've got to respect that. I guess it's a bit of a cliche, isn't it? We hear it all the time, that saying it's okay not to be okay. But actually, when you think about it, it's just so true. There's no pressure for any of us to be appearing to cope. Personally, I've had absolutely fine days, but I've had days where I just thought, oh, when is this going to end? I'm finding it really frustrating, really difficult. And what I don't need is anyone to chastise me for that or to look down on me for that. I just need my colleagues, my peers around me to say, well, hey, Brian, it's okay to have an off day, and they do. And we've got to do that to our students. We've got to educate them that it's okay not to be okay. But I think we have to push it a bit further forward. We're academics, we're working in evidence base. Our students are learning in evidence base. So there is lots of evidence around exercise and relaxation and the impact that can have on managing and dealing with stress and anxiety. I'd encourage our students to find something that actually helps them de-stress and take a step back from the trauma that many of them might be seeing, or the pressured environments that some of them might be working in. For me, that would be just going out for a walk, even if I don't want to, force myself to go out for a walk every day, just get outside in the fresh air, put my headphones on, listen to some music, so I can just kind of escape. But talking to friends through a means like this, Zoe, is really important. And I think you've just got to have some key contacts that you know you can rely on, and make contact with them, even if it's just to say, look, I'm having a bad day today, and just have that conversation and that communication. Probably, I think my last response would probably be, I found it's really helpful to get into a pattern, a routine of how I manage my time and manage my day. And you have to kind of create your normal for the situation you're in, within the parameters that you feel safe within. And I'd encourage our students to do that.
Well, there's that element of the fact that the routine at the first part of lockdown went a little bit out the window, didn't it? And it's getting that new routine again. But I think one thing that we are really proud of is the fact that our students have really pulled together as a community during this time and really pulled each other up to support each other, and I think that's fantastic.
I think what overwhelmed me a little bit, because as you know, I've been involved in the heart of the national policy that was created students, the permission for students to go into practice. And they were really needed, because the NHS just doesn't, the workforce is not where it should be with registered nurses or allied health professionals. And I think, it's really important, and I feel really overwhelmed, the number of students at our university that opted to go in straight away, no hesitation. And it kind of bowled me over, actually. It was quite an emotional moment, because there's always been the thought in my head on a personal issue around, well, what if our students become ill? What if some of them get COVID? What if some of them show symptoms? What if something more serious happens? And I've wrestled with that thought, making a national decision, and then what would the impact of that be locally on some of our students?
Yeah. Okay, so we'll move on to the third question. So we've talked a little bit about this already, but how can we best equip for what we are calling at the moment the new normal?
God, it's a phrase we're all going to come to hate, isn't it? The new normal. Yeah. It's really difficult to answer, because the evidence is still emerging, and I would say that the public perception is still quite confused. What can you do? What can't you do? Newspapers are reporting different things. We're seeing different strategies across different countries, and we're also talking about second spikes, which, if you look at past pandemics, there have been second spikes. Spanish flu would be an example of that. I think what we do know is that social distancing is going to become a part of our life. And that is not going to be without its consequences. If you're a person that likes to hug or to shake hands or to kind of be close to some of your friends or associates, that's not going to happen. We're going to be quite regimented, I think, with kind of 2 metre distancing in shops and in public buildings. Certainly at the university, we've put together a planning group led by my colleagues, who are bringing together a team of people to think, well, what will it look like in the university? And, we're thinking about one-way systems in the buildings, in the corridors, 2 metre distancing at the canteens, maybe a different approach to room usage and space, so that people are safe. So I think social distancing will be part of a new norm. I think masks will be part of a new norm, whether the evidence is that you should use them or not. And as health professionals, we know the dangers of misusing masks. And I think interactions are just going to be different. We're going to see more online interactions, and I think we're going to have to learn how to manage that, so that doesn't become a pressure in itself. And our communication is just going to be quite different. And I think I've always said publicly and in the university, we are in for a long haul. And we are in for a long haul. This is going to go on until we can get a vaccine or some sort of science that helps us protect ourselves, either immunisations or whatever. So I think we're going to see society and attitudes change. but I also think that we'd be really foolish if we didn't expect a little bit of a tsunami of issues that will come out in the wash: depression, anxiety, anger, people who've had sudden loss and bereavement, all of those emotions. So I think we're going to have to deal with much more mental health issues, and that means we're going to have to talk more and interact differently to talk more.
And it's very much that attitude of being prepared and having a long-term plan is really important, I think. And from when we first went into lockdown, there was all that anxiety, wasn't there, of having to have a response immediately, whereas now we're realising that actually a measured and planned response is a better response in terms of the evidence, because we can follow the evidence and look at actually what is happening in the world around us.
But little things in life will change, like holidays. People will have to think quite seriously around, well, will I go on a plane? What will air flights be safe in that God, I can't get the word out of my head. Small space. Sorry, just a moment. Confined. Thank you. And so all those kind of social norms are going to become quite challenging and quite different, and we'll have to work them through as individuals and as a society.
That leads on quite nicely to the last question, really. So we asked this of all of our guests. So from a personal, professional perspective, what positive lessons can we take after lockdown?
Yeah, it's quite a personal question, that, isn't it? Mm-hmm. Well, I think for me, probably a couple of things would come to mind. There's nothing as important in any organisation as its people. And so as a kind of leader in a university, I think I've always valued people. I think I'm quite values driven, but I feel even more value driven and more focused on how you get the best out of people and how you impact and change a culture, such as an organisational culture, by investing in our people. That's our staff and our students. So I'm beginning to think in my head around, as a university, what more do we need to be doing to really get the best out of our staff and to get the best out of our students. So I'm kind of starting some conversations with colleagues around that, around the values. I think there's never been a better time now to really push the kind of environment, the kind of relationship that individuals have with mental health, well-being and the environment. We're a university in the Lake District, for goodness sake. It should be our unique selling point. So I think we've got a bit of work to do around the University of Cumbria, in Cumbria, and our stance as a university with environmental and sustainable issues. I think that's emerged really strongly for me. And I think that will impact every institute, every student, every member of staff. And if it doesn't, then we've failed in some description, would be my perception. And learning to not rush into meetings, for me, on Skype or Zoom or Teams, but actually taking a bit of time just to pause and just ask how people are. Simple question. So I think the personal issue for me there is about how you manage or chair or facilitate a discussion or a meeting by not rushing into it, but just spending a little bit of time just kind of creating the right environment for everyone to feel relaxed and to say if they're not okay or if things have gone bad, and for us to acknowledge that and just accept that.
I think that speaks for itself, Brian. So thank you very much for coming on today.
Thank you. I've really enjoyed it. It's been great to talk to you, and I think your podcast is a great idea.
Thank you very much. All right, I shall see you soon.
Thank you. Bye.
Here at the University of Cumbria. We'll see you there.